What's going on? Hi, Ariana.
Hey, Michael.
What's going on?
Not much, not much. But I think we do need to give the people some awareness of NF2 related schwannomatosis. So, guess we can share our stories.
I mean, let's start by defining what that is. What is NF2 related schwannomatosis?
Yes, so it used to be known as NF2, just neurofibromatosis type 2. But more recently, they classified it as NF2 related schwannomatosis. And basically, it's a neurological condition that primarily affects the central nervous system. I wouldn't say that it just consists of benign tumors that affect the spine or the brain. It affects all systems actually, and maybe that's a common misconception that people have, but it does impact other things as well. So,
Yeah, oh my gosh. Well, I actually have a lot of experience with that. I have NF2. I was diagnosed when I was 20. Um, I was diagnosed in the middle of going to college at the Howard University, HU.
you know.
And luckily, I was able to overcome this diagnosis. But I was very lucky in that I had resources, and my parents were very strong advocates for me, and they had resources to get me the help that I needed. And they were able to educate themselves, educate me, and be up to date on what's going on with NF2 so that I can get the best care possible. And luckily, I had very strong advocates that had prior experience as well that were able to get me the help that I needed to be able to tell the story that I'm able to tell today. So I think it's my duty now to educate people about NF2, NF1, even other related diseases that may share some sort of pathologies with NF2 so that we can mitigate the same sort of struggles that I had to face and I'm still having to face um, right now. Yeah.
Yes, I totally understand that. For me, I was diagnosed at 21. But at 20, after graduating from Howard University, I was teaching at the time. And I remember going to the ER.
Mm.
One night I had woke up with a migraine. I was experiencing vertigo, which is also dizziness, weakness, and slurred speech. And you would think someone would do a scan or whatnot, order a scan, but that didn't happen. And I was told that I was just dehydrated and stressed. Now, two things can be true at once. Those things could have been true, but I also needed a scan done because if a scan was done, it would have caught also the bilateral vestibular schwannomas that I had, which affect your hearing and your balance. So from there, that was in September 2023. And then February 2024, I went to the ER again. And this was a children's hospital. At the time I was 20. So maybe me being closer to 21, maybe they're not taking me as serious as like a pediatric patient. So same results pretty much. And it was not until March that I saw my retina specialist. And he told me, if you were my sister, you would be going to the emergency room today. And so
Mm.
that was when I decided to go to Emory's Hospital in Atlanta, Georgia. And they conducted a CT scan and they ended up seeing the bilateral vestibular schwannomas. And from there, they pretty much diagnosed me with neurofibromatosis. And so, yeah, so I've been managing NF2 as of 2024. It is now 2026. And I'm being frequently monitored, like you, I'm pretty sure, which consists of MRI scans and various doctor's appointments with different specialists. Um, but yeah, that was the story of my diagnosis. So
Wow. Well, I just want to stand up and give you your flowers for getting through the struggles that you went through. I understand that it was somewhat debilitating at the time for you, but you were able to get back up. But I spoke to you when around the time that you were going through this diagnosis, and we have spoken many times. I've had the privilege of, I don't want to say mentoring, but sort of going along with you on this journey of the diagnosis, going through some of the medical aspects of this, because I have a lot of experience myself. But before I dive into that, I wanted to ask you about some of the things that you mentioned. You mentioned you had some problems with proprioception, and you have bilateral vestibular schwannomas. Are those symptoms of NF2?
Yes, one of the hallmarks is the bilateral vestibular schwannomas, especially. I think right off the bat, people know that it's like NF2 related schwannomatosis from that. But growing up, I also had scoliosis, which is more so a sign of NF1 actually.
Mm,
So when the testing was done, the genetic testing, um, well, let me mention that NF2 can be inherited from a parent, that there's a
mm,
50% chance, and there's also a 50% chance that there's a spontaneous or de novo mutation. And for me, it was spontaneous because neither of my parents have the condition. I will say those are like symptoms that play a part. But growing up, I did deal with scoliosis also, which is another symptom more so of NF1, and cafe au lait spots, which
mm,
is like another symptom of NF1 more so. But things that I dealt with that we thought were just like birthmarks or these marks on my face that are neurofibromas, we thought that they were just moles. So you kind of just brush
mm.
it off like you don't really know and people aren't really aware. So yeah.
Yeah. Um, I think that is very interesting that you mentioned your bivestibular schwannomas and proprioception in relation to um, other symptoms that you saw early on. I had a couple early symptoms that
Mhm.
I thought I saw as well, leading up actually a little closer to the time of my diagnosis. The summer before I was diagnosed when I was 20. Um, I had started to lose my hearing a bit, and when I first went to the doctor to see what was going on, they thought that it was just allergies and residual pollen buildup of phlegm and mucus in my sinuses and my airways, and that was just causing a blockage in my ear canal.
Mhm.
And it just would not go away. And I was starting to think, I think this is a little bit more than just allergies. Um, but I never really said anything because um, I just never said anything. I don't know why. In hindsight, hindsight, of course, is 2020. With that being said, I was an idiot. I didn't say anything. I let the symptoms get nasty. And because of that, I had to go through some things like now I can't hear out of my left ear at all. And that was where I was beginning to lose that hearing before. Um, so with that being said, I urge everyone to go to the doctor and get that weird itch checked out. You never know what's really going on, and be insistent that something really is going on, you know? Be insistent that you really are experiencing what you're experiencing as well.
Yeah. Same thing with me when my hearing started going out of my left ear also. It felt like water was in my ear. You know, when you go
Yeah,
swimming in too much water, it gets
yeah.
in your ear. That's what it felt like one day when I woke up, and then the next day it completely went out.
Mm,
And so I guess at that point it was too late to get the hearing back in that ear. And I remember going to the nurse's office, like where I work. I work at a children's hospital. And I was getting over a cold. And so the nurse didn't see anything, and so we kind of were just like, well, you know, it is what it is. Weren't thinking much of it. But also at that time I remember my vision blacking out when I would reach on shelves for certain things. And I think oftentimes like we just brush things off, like who would think it would be something like this?
Right.
But no, like it really can be that extreme. And I think we both figured that out. So yeah.
Yeah, for sure, for sure.
Yeah.
Um, I mean, besides you noticing those small symptoms, were there was there anything about your interactions with other people? Did people say anything to you about um how you walked, how you talked, you not being able to hear as well, you maybe not being able to see as well, you know, losing your balance a lot easier leading up to your diagnosis?
Yeah, I remember I had corrective eye muscle surgery when I was like 4 years old. And it's always been like my left eye. I have a lazy eye or amblyopia. And so that's something that can, be a part of this as well. But again, we didn't really think much of that. I know that's something that happened, and my aunt also mentioned like my shoulders were a bit uneven and maybe the scoliosis. But again, we didn't really know of enough too. But those are like the only things pretty much. How about you?
For me, it was really the hearing leading up to that diagnosis. And then I also there was some balance issues that I had, but I thought that I was just not drinking enough water, not eating enough, like a classic college student, right?
Yeah.
Um, but that was not the case.
Yeah.
Um, and it turned into something a bit more drastic. And unfortunately, when I went to pursue help, it was after my mother actually said, "Honey,
Mhm.
you need to go to the student health center or I will take you to the student health center. To I need to fly into Washington, D.C. and take you there myself." And I said, let me not disturb my mom. Let me not make her get off work and take me because I know she will.
Yeah.
And so I then took myself to the student health center. They thought I was having a stroke when I first got there. My pupils were dilated. I was having slurred speech. Um, my heart rate was wildly elevated. Um, and I was also having a facial droop. So they were not sure what was going on. Um, and I know that for my parents, it must have been very scary. Um, and because for me, it was very scary. I had to get hospital to the actual hospital, not just the student health center. I was rushed into emergency surgery the next week. Um, Rushed makes it sound very, very dramatic. I was brought into, I did go through emergency brain surgery, I did, but it was not like I was rushed into surgery. I I got surgery on my brain. I had about 8 total surgeries that round. I've had maybe 15 overall in total. Um, different types.
Mhm.
BP shunt, um, installations, replacement surgeries, um, craniotomies to remove tumors. Um, I've had corrections to drain out pockets of cerebral spinal fluid that was stuck in between my dura and my skin. So I've had a lot going on in my time, in my few years on this planet. I've gone through a lot. And I've done a lot and I've experienced a lot, but I'm blessed in that I've learned a lot. And I know about a lot of different struggles that come from NF that are not just everyday occurrences that people don't really think about, but I'm talking about things as small as standing up to um, put your shoes on, you know, I'm talking about walking down the stairs. I'm talking about walking to the door. I'm
Yeah.
talking about waking up in the morning. I'm talking about having a seizure and then having to go to work the next day. I'm talking about stuff that people don't really think about, but disabilities really are invisible a lot of the time.
Mhm.
And I think that it's so important now more than ever to emphasize that message so that we can not only spread awareness, but remember who we're doing it for and why.
I get a lot of what you are saying. For me, I had a VP shunt insertion in August 2024. In February 2025, I had my first craniotomy. And then in March 2026, I had my first spinal surgery. And I will say I've been out of work for like 4 months now. And I had my first seizure in December of last year, so 2025. It
Mm,
was a tonic-clonic seizure, and I haven't been able to drive for like six
mm.
months, legally. And so it changes some things for you, like activities of daily living. Things just end up being different. And I get what you were saying about some things coming off as invisible. And I think that's now the phase of life that like I'm in where I'm having to learn how to advocate for myself because some
Right.
people really don't understand that like this is a actual condition in which we do deal with things that sometimes will come off as invisible. Like 1 minute you're balancing fine, like you can walk with no problem.
Yeah. Yeah,
And
for
then the
sure.
next minute you're struggling with your walking. Like this
Yeah,
is a real
yeah.
thing.
It's it's a lot. Um, but one thing that I know is that research and advocacy are two of the most powerful things that we have
Right.
in our toolbox to really enable us to fight back and not be overcome by the inequities that we face in everyday life, you know? Not to mention um, the great lengths that we are going to be extraordinary. You yourself just recently got into a master's in public health program at Emory University. That is fantastic. That is excellent, but that's not even your final destination, I hear. You are going to continue your education and pursue a MD. You don't know where yet, but you know that's the final goal for you in terms of your degree path, right? That's fantastic. And you're making good on that promise. That's incredible. And that should be applauded. So hats off to you.
Thank you. And what about you? What's your long-term goal?
Oh my gosh. I don't even know. So my life I'm in I'm in exploration phase, but right currently I am doing research on strokes and neurodegenerative diseases. I'm in a program called HUERA Prep. Shout out my cohort. How y'all doing? Um, and we are trying to expand research on Alzheimer's and related dementias and neurodegenerative diseases. So that's the mission, and that's what we're doing. And I am so proud to be part of this cohort. There's some very excellent future neuroscientists and neuroscientists now, but excellent people in the cohort. Um, but besides that, I'm trying to do this advocacy gig, spread the word about um, things that I am passionate about. Um, there are, you know, I do some mentoring activities as well. There are some things that, you know, um, I like to do to stay grounded and remember where I'm trying to go and my true purpose, which is to help people.
Mhm.
Um, so I do a lot of volunteering at Christ House, which is a um, hospital for men experiencing homelessness. So I want to shout them out as well. They do fantastic work. And yeah, that's what's keeping me busy right now. But I don't know what the future holds. We might have to, that's what this period is for. We're trying to figure it out.
Right, right. I totally agree. And I also agree that research and advocacy is how we continue to spread awareness and honestly, just sharing our stories. Because there are so many people that have never heard of this condition.
Yeah.
And usually it affects about 1 in 33,000 people. So
Wow.
it's not common. NF1 is more common than NF2 related schwannomatosis.
Right.
So, and also, it's been said that there's no cure. For me personally, though, I believe that there's a cure for anything because I do believe in Jesus and He is a healer.
Amen. Amen. Amen.
So yeah,
Amen.
that's what I truly believe. And I'm gonna keep the hope and the faith concerning this situation.
Absolutely.
I do want to shout out Dr. Farina because she's pretty much the one that had told me
Hey,
to
here, here,
focus.
Dr. Stacy Farina.
Yes. At
Yes,
Howard University, one of the best professors. I've been in touch with her since graduating,
as well.
and she was telling me that she had a student at the time that also had NF2. And so it was like, well, that's interesting because I told her after I got diagnosed. And so she was going to check with you to pretty much see if it was okay to connect us. And from there, we were connected, and so I have been able to receive much advice from Michael, and so I'm truly grateful for that because I'm not going through this situation alone. And it's just great to know somebody else that honestly can relate with you. The condition itself is not great, like having the
Oh my
condition, but
God.
knowing somebody else that like
Yeah,
you're not able to
yeah,
go through this, you don't have to go through it alone with this,
yeah. It's definitely a scary thing to be told at 20, 21 years old, ma'am, sir, you have brain tumors.
right?
And multiple. So it's definitely nice to have a peer go through that with you, not necessarily um, the same exact thing. Luckily for Ariana and I, we did go through very, very similar things. So I was able to help her in that way. But it's just it was a blessing, honestly, to be that person for somebody else. So I'm glad that I met Ariana in this way. Obviously, I don't want her to be sick. That's not what I mean. But I'm glad you know what I mean. Like I'm glad I know the girl.
Yeah. It's scary to hear about brain tumors. It's also scary to hear that like all of your hair has to be removed in like one area for the surgery.
Yeah.
That was the
Oh my
scary part.
goodness.
I was like, shave my hair. Wait a minute. My hair was like much longer than it is now. But like it was going last year in 2025. And so since then I've been able to grow it out. But hair grows back and some things are
Hair grows
superficial
back.
anyway. Your health is most important. But
Yeah.
it can be a scary thing if you let it, but having that faith and having that support system is very important when dealing with something like this. So, yeah.
What was one, who was your rock during this time? Besides me, of course.
Um, I would say my mother because although like neither of us knew much about the condition, we had to research more. She's been with me through like every hospital stay pretty much.
Yeah.
And she reminds me of like the faith that I'm supposed to have through this. And so it empowers me to keep going, to keep striving. So yeah. How about you?
I hate I hate to be a copycat, but honestly, same like my mom. I call her mommy still. Um, there is nobody that I can fathom besides my dad. But even so, honestly, I think I'd rather have my mom go through a very difficult, trying, not just physically painful, but emotionally painful, spiritually, of course, mentally, right? Um, but you're feeling all of these things. you don't know where you are most of the time, like quite literally. Um, and I mean that in almost every sense of the word. Like you literally don't know where you are some of the time. Um, and it's so isolating. But my mom made she made it imperative for me to not do that to myself,
Mm-hmm.
to not isolate myself during this time that I was going through hardship. And I know I don't know if she was scared, but I know that she was uncertain,
Mm-hmm.
which to me was that was the most scary thing, to know that no, this is something that this is something that nobody really can control, you know? But to know that I had someone there regardless, that was the most powerful thing for me. Oh, and then of course, like my dad he was great as well. My dad was fantastic as well. My parents, both of
Yeah, I love that.
them.
But yeah,
Last but not least, how do you think we can make NF2 less of a mystical disease that no one's ever heard of before and something that has more name recognition?
yeah. Um, Honestly, I think, as I was saying before, sharing our stories more, but being transparent about the things that we're going through, because some people just literally like don't know until they hear of certain things. And it's not their fault for not knowing, especially people that aren't in medicine, that don't study things of this sort. Um, but sometimes it's like an everyday person that doesn't know these things. I think that just our existence and dealing with the things that we deal with, or even like, it gives me an opportunity to share what NF2 related schwannomatosis is when like people think these are moles or they bring something else up.
Mm,
Like talking about it casually like that, I think helps bring awareness to it. And again, the research and advocacy. But yeah, just sharing our own stories.
I agree. Shout out the Children's Tumor Foundation. They're doing some great work in advocating, spreading the word, funding research, advocating for research on NF2. Um, that's fantastic. Um, I also know the national, no, the Children's National Hospital, excuse me. Um, they are one of the leading institutions in the US that do research on NF2, treat NF2, of course, pediatric cases, but it's good that there is care, period,
Right.
right? Um, because it's not everyone's knowledgeable about it because it is so rare. But yeah, I think that's about our time.
Oh yeah.
So, but it was a good catching up, a good chat.
Yes, it
I'll
was.
talk to you later.
Okay.
Oh, and your dog.
My
Okay.
emotional support animal.
I need to see my emotional support animal. I don't have one. I need to get one.
Yeah, maybe so. Maybe so.
Get on. I need to get on.
Happy NF Awareness Month.
Happy NF Awareness Month to you
Talk
too.
to you later.
I'll talk to you later.
Okay.
All
Bye-bye.
right.